Hello everyone, you're watching PhysioClassroom channel and this is our last video of the acromioclavicular joint series. And in this video we are going to learn how to perform the acromioclavicular joint superior to inferior and anterior to posterior pull technique. Utilize this treatment technique in cases of frozen shoulder and acromioclavicular joint arthritis. The technique will help in improving the mobility of the acromioclavicular joint, as this is very crucial in actually restoring the range of motion of the shoulder complex as a whole. Now it is important to understand that whenever the scapulothoracic joint moves during the shoulder elevation movement, this movement is actually transferred from the scapulothoracic glenohumeral joint to the sternoclavicular joint via the acromioclavicular joint. And if this particular joint is not functioning properly, then it can significantly impair the range of motion of shoulder complex region. For example, in frozen shoulder cases. So let's understand how to restore this mobility and help such patients by improving range and decreasing pain. So to perform the technique, the therapist makes the patient lie down in prone lying position so that the affected side shoulder joint is abducted around 45 degrees and elbow is placed in the 90-degree flexed position. Now from here, the therapist stands on the affected side facing in the oblique and cephalad direction. The elbow joint of the right-sided shoulder joint, which is our treatment side, is stabilized between the knees of the therapist in this particular manner. Now from here, the therapist is going to use the second and third phalanx of the middle finger and is going to place it over the superior border of the clavicle, while the other fingers are going to remain in the adducted position. The left hand is going to further provide stability to the right hand, which is our mobilizing hand, and from here the left forearm is going to be placed over the scapula to stabilize it. With the therapist's trunk bent forward, now from here the therapist is going to apply a superior to inferior force utilizing both the hands and also transferring the body weight in the backward direction. Now without loosening any tension, the therapist next delivers an oblique superior to inferior thrust to the acromioclavicular joint to restore the mobility. So this was all about the practical demonstration of the superior to inferior and anterior to posterior acromioclavicular joint pull technique. The technique was intended to restore the joint play of the clavicle from the superior to inferior and anterior to posterior direction. So see you all in our new series of educational videos. Till then,
Keep learning,
keep sharing and stay connected.